Afternoon. I am Omar Pérez Aybar, the Special Agent in charge of the Office of Inspector General for Health and Human Services. And today's announcement is a culmination of a deliberately measured investigation, aptly named Operation Nightingale, where it involved nursing schools in Florida selling fraudulent diplomas and transcripts across the country. The deeply concerning allegations at the center of this investigation goes against the very tenets of the nursing profession. The alleged conduct by these individuals and those who received the fake documents is an affront to Florence Nightingale, the founder of modern nursing standards, the namesake of the world's first nursing school, and for whom the Hippocratic Oath was modified and named the Nightingale Pledge. Now, upon completing their training, nurses pledge to, among other things, abstain from whatever is deleterious and mischievous, and do all that is in their power to maintain and elevate the standard of the profession. The individuals charged today facilitated countless individuals to sully that pledge. Naturally, investigating a scheme involving fake nursing diplomas and transcripts is at the heart of our agency's mission to protect the health and well-being of the American public, especially children and the elderly who benefit from HHS programs, including Medicare and Medicaid. It is true that in this case, we identified several types of healthcare facilities where some of the individuals with these fake documents may be providing services. I want to assure you now that to date, we have not learned of nor uncovered any evidence of patient harm stemming from these individuals potentially providing services to patients. Now, that potential harm to patients is precisely why we've been working with the state licensing boards from the onset of this investigation, sharing as much as we can, as fast as we can, so that they can assess what actions to take to prevent these individuals from rendering care. We encourage anyone with any concerns to contact their state's licensing boards or their healthcare provider. Finally, I want to commend the women and men in the law enforcement agencies represented on this stage. While the work on this case is extremely challenging, your passion and dedication to safeguard the public was evident. And on behalf of Ms. Nightingale, I applaud your efforts to protect patients and the integrity of the honorable nursing profession.